right, guys, welcome to the first group panel recording for the AJC Strategies podcast. I'm really excited to be here today with three really phenomenal, awesome public health students who I have had the privilege to know. And we're going to get to some conversations around the COVID vaccine, around public health and the Black community and communities of color, and just, like race-related health disparities or anything else of the sort. So let's get started. First, we have Breana Turner, who is a second-year Master of Public Health student at Virginia Tech, concentrating in public health education. So Breana is a multifaceted woman who has a passion for empowering other women. She's the founder of Sisters with Ambition, a mentoring and confidence-cultivating program for middle and high school young women. As a proud member of Alpha Kappa Alpha Sorority Incorporated, she understands the importance of service to all mankind. Breana often uses her platform and voice to bring awareness to the importance of women's health and empowerment. She will graduate in May 2021 with her Master of Public Health from Virginia Tech, and she holds a Bachelor of Science in Kinesiology from George Mason University. After graduation, Breana plans to pursue a PhD in Translational Biology, Medicine, and Health to research pressing issues and provide solutions to some of public health's most wicked problems. Ultimately, she continuously aspires to advocate for women's health, advance health equity, and uplift and empower others. So welcome, Breana. So excited to have you.
Thank you.
Awesome. So next we have Vanessa Mallory, pronoun she, her, hers, candidate for MPH at UNC Charlotte. And Vanessa is a second-year graduate student at the University of North Carolina at Charlotte. She is pursuing her master's in public health, concentrating in epidemiology. Vanessa is originally from Columbia, Maryland, and she graduated from Alabama State University with her bachelor's degree in May 2019. Some of her public health interests include maternal and child health, substance abuse disorders, environment justice, and mental health. When Vanessa is not focusing on her studies, she enjoys reading for her leisure, journaling, watching basketball, and watching anime. Welcome, Vanessa.
Thank you.
And last but not least, I feel like the person I've known the longest, we have Toulia, Nwabunnia, MPH candidate at Boston University. Toulia was raised in Maryland in a Nigerian Liberian household and will not let you forget it. The child of immigrants whose sole focus was searching for new opportunities for their children. She attended the Madeira School in VA and went in Virginia, VA, and went on to graduate from Vanderbilt University, where she received her Bachelor of Arts, majoring in Medicine, Health, and Society, and minoring in Human and Organizational Development. After graduation, she worked for 2 years at the Center for Program Integrity at CMS, Center for Medicare and Medicaid Services, and is currently focusing on her studies at Boston University in the School of Public Health and Community Assessment Program. It's Community Assessment, Program Design, Implementation, and Evaluation, as well as Global Health. She loves spoken word poetry and, of course, Beyonce. So thank you. Welcome to all of you guys. I felt like at first I don't normally read the long bio, but I was like, they just have so many accomplishments and like special research points. Like I'm just like, let the bio speak for themselves. So y'all doing that. I'm really excited for this conversation, and I'm really excited for like what it's going to do and like the eyes it's going to open up. Just kind of giving like my perspective. I work in corporate communications, and I also have just been someone who's been very adamant and vocal about like COVID vaccines. And one of the things that I've just seen from my experience personally in my community with some family members, with people, just family friends, as well as different people from just different organizations, is a lack of wanting to take the COVID vaccine due to like racial and historical themes that have happened. There is a very pressing fear, which I understand, and it is trauma induced and trauma informed. But then there's also, and I think what really inspired me to want to have this conversation was the like anti-vax movement that I saw co-opt that trauma and then take it on as like anti-vax rhetoric to further their own agenda. And I think like that really like boiled my blood, because it was like, these are not the same. And to like try and misinform a group of people for your own agenda, not recognizing all of the racial, like not even undertones, but like racial things that have happened there. This in itself is also racist and like, anti-Black to do such. So I was like, how can we get information out to people? How can I do my part and utilize my resources? And so just before we even get to COVID, like, can we just like take a look at the like historical public health crises within the Black community? and kind of like how has science or medicine like just mishandled Black patients in the past?
So, you know me, I feel like you know where I'm about to take this conversation real quick. But when I think about the history of this country, and particularly when it comes to Black women and then in general Black pain, it's rooted in racism, period. And the one thing that catches my attention and my eye so much is the father of gynecology or the mother of gynecology. So the father of gynecology, James Marion Sims, and the mothers of gynecology, Annika, Betsy, and Lucy. So these were enslaved women. And James Marion Sims performed unconsensual operations on these women. And in doing so, he basically created ideologies that Black women don't experience pain or they experience less pain. Obviously not true. So after he practiced on these enslaved women, he then went on to the white women and used the anesthesiology and used all the pain medicine and the drugs on them. However, this mentality that Black women in particular do not feel pain has manifested into the high maternal mortality rates that Black and African American women face. It reminds me of the things you see on Twitter where someone's mom, aunt, they go to the hospital and they have chest pain. The doctor writes it off as anxiety. Or even from my own personal experience, I've had GI issues all my life, and people often wrote it off as anxiety or I'm just stressed out and different things like that. And that's just simply not true. So in 2016, UVA even put out a study and they found that the majority of the medical residence students, so people that are going to be practicing physicians, thought that Black Americans had thicker skin. They did not have the same pain levels as compared to white patients, and they even could feel less pain. So again, all these things are rooted in slavery. They're rooted in racism, and you see it just being manifested and mismanaged in modern day times.
Yeah.
I think also that when talking about, especially the way the Black community relates to medicine, we think about the Tuskegee syphilis experiments and the fact that, we understand that not only is it something that like medical people do on a one-to-one basis of, disregarding our pain or feeling that we don't have pain, but that this is something that was sanctioned, the US government saying, okay, we're going to treat people for syphilis, and rather than treat them, just studies the effects of syphilis left untreated in these people's bodies, and these people are out in the community living their lives, procreating, and that can have such negative long-term effects on them and their children to come. And so I think that we have also the history of that, understanding that it's really that systemic disregard for our lives.
Yeah. Vanessa, do you want to add in on that?
I agree with both of those points, and it also kind of brings up the topic of like Henrietta Lacks and looking at how she went in for a procedure and the doctors did things without regard to her or even getting her consent and taking her cells and using those for years on and conducting scientific experiments with those cells. And I think sometimes that can come about within daily interactions with people of minority communities, interacting with healthcare providers and wondering, am I going in for one procedure and receiving things that I don't necessarily need? Are they prescribing medications I don't need? What actually is going on? And I think it comes down to that communication too. The healthcare providers might not have, and making sure that they articulate exactly what's going on, exactly what will be done in procedures to make sure there's a level of comfortability for people who are experiencing some of that trauma from the systematic things that have occurred with the healthcare system.
Yeah, and I think one of the things too that because Henrietta Lacks is also like frequently where my mind goes, as well as the Mississippi appendectomies of just like making Black women infertile and then saying, oh, well, they have better economic outcomes, so Black people just shouldn't have kids. Like that's eugenics. So, it is one of the things that I kind of come back to too is like that education level, because Henrietta Lacks being illiterate, when she signed her waiver, she didn't know what she was signing on to. Which has led to people, having to explain like what, you're signing when you sign these medical contracts. But these are like almost like social determinants. Like how can you explain what social determinants are? And like, what are some of the failures by public health administrations to like properly address those social determinants in providing adequate health care to people of color?
So I think when we talk about social determinants, what we're really talking about it's difficult because it's really everything. It's all the exposures that we have in our lifetime that can kind of underlie our health outcomes and even constrain the decisions that we make on a day-to-day basis. So I think often clinically people talk about, you eat this, you exercise, you do these things, and those directly affect your health. But it's more about okay, like what does your housing look like? Does your transportation look like? Do you live 2 hours from the closest hospital? And you have all these other factors in your life that preclude you from seeking preventative care? Do you have sidewalks in your neighborhood, clean air, et cetera? So all of those exposures, and then also the systemic structures like racism, like capitalism, that we live in every day, that really are going to shape not just what we have access to, but how people see us and receive us in the world. And then also, we know, play into health inequities and these disparities that we've already mentioned. So social determinants is everything. It's a lot to talk about, but.
Yeah, I think that's a great definition for one, because I feel like it's something that seems like really big, but just thinking about your identity and like all the pieces of that and how that affects how you like receive and like the quality of healthcare that you receive. And so kind of getting into, you guys understand like the historical aspects of this. You've been studying it for a few years now. What really made you, excuse me, what really made you choose like healthcare and like public health, medicine, however you're kind of entering the space, like as a field, and like what's your motivation specifically for this work?
So for me, I will never stop saying representation matters, because it truly is everything. And just long story short, on my second day of undergrad, I was taking a global health class as an easy a credit I had to fulfill. My professor walks in. At first, I thought she was a student, but no, she was a 28-year-old Black woman who had a PhD and 2 masters. And she taught the course, fell in love with public health. I took another course the next semester solely because of her, but she mentored me, took me underneath her wing. And by junior year, I was pretty set on, I'm getting my MPH. This is awesome. It's a field that really prioritizes preventative nature and not necessarily just reactionary, which is really key when it comes to public health. And just the amount of change that you can create and make for the populations of people, and not just on an individual level like a doctor or, a provider in that sense. But what I had in mind junior year of college obviously is changed a lot, being a second year student. And then just being in this pandemic, I'm truly understanding the need for public health, the need for Black women in public health, because we just bring another layer of cultural competency, of cultural relevancy into reaching the minoritized communities. And then for me specifically, I want to do research and work surrounding Black women. And that's so neat because the data and the research, that's what's going to inform providers and interventions and just different things like that.
Awesome.
So some similarities and why I'm interested in public health as well. I definitely always wanted to be in a career where I can impact as much as possible, whether that was teaching, becoming a nurse, or a medical doctor. I always wanted to make sure that I was impacting people. And I kind of stumbled upon public health. I wanted to be a physical therapist for most of undergrad, but then I changed my whole career path. And I started doing research on just different things that kind of encompassed my interests. And I like that public health has so much variety. There's so many things that you can study, and there's so many avenues that you can take it. And I feel like you can really make the degree work for your interests. So that was definitely one reason why I settled on it. And then also just wanting to advocate for communities that don't have advocates, people that their voices typically get overlooked and not heard by people. I wanted to be the person that will make sure that I listen and I advocated for those communities, because that's always been a thing where I felt like I haven't been heard when I'm advocating for myself. And so I knew once I got into the position where I could kind of advocate for others, that I would make sure to always do that.
That's
yeah,
dope.
So I also had similar motivations. And so I was in a class at Vandy, and my professor was discussing with us maternal mortality rates and disparities for Black women. And she made this point that, the disparities persist regardless of how educated or how wealthy Black women are. And so, you know, we often think about education and money as things that can kind of protect us from poor health outcomes, because those things increase our access, right? But for Black women, that's not the case, right? So we still have those disparities. And I think for me, that was kind of like a gut check. And so that's one of my primary motivations. And then also, I had a professor here who was talking to us about systems change. And he was saying, you know, rather than treating a sick fish, right? This is just go with the analogy. Rather than treating a sick fish, why don't you treat the source of what's making them sick? If the sickness is in the water, right? You have to fix the water. You have to heal the water. So trying to change the structures within which we live that kind of help these inequities persist is really one of my driving motivations. And it's definitely, it's large and it's idealistic, but it's why I'm here.
That's awesome. And I think that analogy really makes a lot of sense too. Like, not just treating the person, but like, what is the cause of that? Especially when, like, again, so much of the social determinants, whether that's poverty or like, you know, like lack of, you know, access to clean water, something like that, certain things like that kind of play a role, or not kind of, but they do play a role in what we're seeing and like what people go to the doctor with, if they even go to the doctor at all. Because we also know, like, within our community, you know, people are good for some like drink this ginger ale and lay down, and it is like, no, like, your appendix is rupturing, this is not the time to drink ginger ale, like, please go to the hospital. And then there's questions of like insurance and like just stuff like that, where it becomes a larger prolonged system. Like, I've seen things of like people taking Ubers to the hospital because they know that they can't afford an ambulance, but it's like, you probably need the urgency of an ambulance, but you can't take that like $700 bill. And just all kinds of things like that I think go over people's heads day to day, especially people who have access to healthcare and access to like quality health systems. And especially like, we're all like DMV, like at least like originated. So you have like pretty great hospitals around here, and you have your choice of several. It's not just, you know, one or two, which is a privilege that many people don't have. So all of that's really helpful in contextualizing why you guys are in that field, but how that plays a role in society, and kind of like just talking about public health in general. I remember I was having a conversation with you, Breana. You were kind of talking about like how like public health is like one of the reasons we have things like seatbelts or things like stoplights. So can you kind of talk about like from more of a generalized sense, so that I know, like, we know it's medicine. We've talked about kind of like the intersections of race, but how public health is part of really so much of our everyday life as we know it now, compared to necessarily like, it's not always necessarily that heavy, like medicinal kind of structure.
Yes. So one thing I always like to point out is, if you remember when we were in elementary school, possibly middle school, but the Got Milk campaigns, you see like, you know, Serena Williams or Michael Jordan with the milk mustache, that was to help increase calcium intake in kids. So that's a form of public health, that's health communication. So, you know, not just pandemic heavy stuff. If we look at car crashes, why do cars crash? Oh, or what happens in car accidents? If people are not wearing their seatbelts, they're going to get hurt. All right, let's push for click it or ticket, public health initiative. Smoking cessation programs. If you remember, there used to be non-smoking and smoking sections in a restaurant. Non-smoking sections, and smoking sections now, it's just non-smoking because of public health. You cannot smoke in like a 50 feet from a building now or something on the state. That's all public health. So it's truly trying to change the health outcomes and trying to find programs or interventions to accomplish those positive change with health outcomes.
Yeah. And that's helpful, because I think that like now, because of COVID, everyone's like, oh, mask, or like, you know, what is the CDC saying? Like, I was like, y'all have never worried about what the CDC said before this. Like, just even like washing your hands, like people being like, oh, you're supposed to wash it for 20 seconds. It's like, I know y'all weren't even using soap. So it's just like getting to a point now where it's like, these are things that some of them we should have been doing, right? I think like the mask obviously was like a change, but like just people actually relying on reputable sources for like health information. And even though COVID has been just extremely devastating for not only the world, but especially within our community, I think starting to have figures of like kind of people within medicine, people within science who we can look to be like leaders in this space is at least an advantage in this kind of, you know, world that we're in now. And kind of making that pivot to COVID, you know, like I think it's such a buzz topic now, but I want to really break it down to the basic elements. So like in a really simple way, like can you explain like what COVID is? Like just the name, what it affects in terms of like our body, where we believe it originated from, because the 5G and the like you know, like it's just the extra stuff. I just want people to like from a basic standpoint, because I'm a super nerd, so I'll be talking to people about stuff just from a basic standpoint, like what is COVID?
I'm dead at the 5G.
Look, this time last year, people thought it was 5G, and I was like, I don't think that's what it is. Like, I just don't. Like, Carrie Hilson, please put your phone away. It's the second time you done got yourself in trouble. Like,
okay, so breaking down COVID-19. COVID, literally the CO, corona, the VI, virus, the D, disease, and the 2019, because that's when we think it presented itself. And so it is a respiratory virus. And basically that means that it affects our breathing system in the simplest terms. And that's why we see a lot of major damage being done to people's lungs. But I think the thing about COVID that makes it hard to control the misinformation is because it does present itself so differently from person to person. And so, you know, some people are saying it just feels like the flu. Well, I've had the flu. That's not fun either. But then, you know, some people are in the hospital on ventilators. And so that's one of the reasons why it's so important that we take those precautions and follow the guidelines by the CDC and the World Health Organization, because, you know, you could get COVID and maybe it's not the worst thing in the world for you, or you could get it and maybe you're a young, healthy person and you could still have devastating consequences to your body. So yeah, that's COVID. It's a virus. And we know that, I think they said October or November of 2019 is when they really think that it started circulating, even though we didn't really have shutdowns and stuff until February, March of 2020.
right. And then kind of too, so the name like corona coming from like that crown of like spike protein. And so can you kind of talk about like, if, I mean, and maybe this is too molecular for people, maybe this is me just nerding out, but like how like the spike protein like plays a role in like how we get infected, because we're seeing variants now which are adapted spike proteins, which is increasing the transmissibility. So I know like John Hopkins, the Bloomberg School of Health, did like a whole like kind of like infographic thing on like the iterations of it. But can like any of you guys speak to kind of what that means with the variants and the spike protein in terms of like our ability to contract COVID?
So I'll speak to the mutations. So basically, when people don't want to wear masks, they want to still wild out in the streets, and they're not vaccinated yet, or even fully vaccinated past the 2 to 3 weeks to the efficacy to kick up, viruses want to survive. And so they're going to, as long as they have a host, we are the host, we are the people that are hosting this party of coronaviruses. As long as we have a host, they're going to continue to mutate to increase survivorship, increase be easily transmitted. And then in some cases, what we're seeing with the California variant, they're actually saying that this one might be more deadly based on preliminary studies. So the goal of the virus is to survive. And as long as we don't have lockdowns, as long as we're not wearing masks, as long as we're still not fully vaccinated or reaching that herd immunity based on the vaccinations, the viruses are going to continue to mutate and continue to wreak havoc on society. And so that's why you're seeing a lot of these variations, because they have hosts, they have places to go and places to continue to thrive.
Yeah. And I think that like, that's not emphasized enough with people. But Vanessa, sorry, were you going to add something? I don't want to cut you off.
Just speaking to what Breana said about the variants, the one thing I realized is I recently just recovered from COVID, and knowing that I had one variant of the virus. So like still being recovered, I still wear a mask, and I tell my grandmother to wear a mask even though she's recovered from COVID, because there are different variants out there, and they aren't really sure about the antibodies and the resistance and like our immunity and how long that actually stays once you've had COVID. And so just like pushing for people to wear that mask is even harder once they've recovered from COVID, because if they had a strand that was less deadly, or they didn't really have any symptoms, or they were asymptomatic and just had that positive test, then if they're going out thinking they have all of this resistance and all these antibodies, but there's so many variants of this virus that it's like we can't really push for just people thinking like I've recovered and it's fine.
And I think two things that you just said that are important. One is that they're different strands. So people are like the variant. I'm like, there's more than one. There's at least 4 or 5 that they've identified now. And each one of those is a different kind of mutation. So understanding that like it's not just this one, different coronavirus we've seen. Like we're seeing like multiple kinds of, coronavirus. And then 2, when you were talking about antibodies, that's a really important part of this conversation, because we know that like COVID, when you have a disease, right, your body builds antibodies, but a lot of people are kind of using that as a means of like saying, I don't need to get the vaccine because I already had COVID and I have the antibody, so I'm fine. So that's a perfect transition point into like, how do vaccines work and like, what are they? But then also like, how does that relate to people actually getting the COVID vaccine?
So like you said, first of all, the antibodies that you have after you experience COVID do not last forever. So that is one of the main reasons why you should definitely still be getting vaccinated, on top of the fact that, again, there are all these different strains and mutations. But so basically the way vaccines work, we introduce a small portion of a pathogen. So the pathogen in this case is the virus or the bacteria or whatever it is that would cause an illness into the body. And your body creates an immune response, right? So your body fights off whatever that small portion of that virus is. And then your body remembers that response. So now if you're out and about in the world and a coronavirus is attempting to, play host, or is attempting to make a host in your body knows how to fight that off. Right. And so that's like the simplest way that vaccines work. But they work best as a population level intervention. So when more people are vaccinated, as Breana was saying earlier, because then there are fewer opportunities for that virus to kind of latch on to a person and to mutate in bodies, right? So we want as many people vaccinated as possible, because that's how we get that community protection rather than just one person being vaccinated. And so, again, it's important that you understand that when you're vaccinated, it's not as if you get the shot today and then today you are protected from coronavirus. No, you have to, first of all, let that time period of a couple weeks play out. And in that time, you can still be infected. And in that time, you can still be infecting other people. And they are not sure whether or not being vaccinated will preclude people from being able to transmit COVID at all. And so it's important that, again, we still stay double masked up. We're still social distancing and just taking all of those precautions.
And to build off of that, one thing I do want to clarify is that the vaccines that are available in the United States of America right now, Pfizer and Moderna, they do not have a live pathogen in it. It's an mRNA technology, so messenger RNA. And for everybody that might be a little bit skeptical as to why this vaccine could be happening so quickly, one, mRNA technology has been being studied for almost the last 30 years. And then on top of that, y'all, we have iPhones, okay? We got the technology to have, iPhones, iPads, very great computers relatively quickly. It's not 1918, it's not 1920. And so it does make sense for science to progress, which is why we have the ability to create such a credible vaccine very quickly. And the key component of these mRNA vaccines, specifically the Pfizer, Moderna, and then also the Johnson & Johnson one just got approved for the emergency distribution, they prevent death and severe illness. And that is what's important, that people are not dying when they get the COVID vaccine and it's taken the full course of efficacy and they're not having severe illness. And just also to explain the 2-shot mechanism thing, because I know people arguing on Facebook talking about why I got to go back. I already got one. I felt terrible. I'm not getting the other one. So I like wearing makeup, right? And you put on primer first, and then you put on your foundation to make it like really stay and last. So the first shot of the Moderna and the Pfizer vaccine, it acts as your primer. It like kicks up your immunity a little bit. You're like, okay, this is cute. I'm getting, my T cells are working. Then you get the next one, and then you're like, that's like the pretty one. That's when you can really start beating out your face. So the second shot is really what's going to kick up that immunity. And then you have to wait the 2 to 3 weeks for the efficacy to really, actually take effect, because like you can still get COVID if you have prior exposure in between the shots or after you get the second shot, because it takes a while for the full beat to take place.
I love that analogy, first and foremost.
I also love that.
I love that analogy.
That was fabulous.
Yes.
That everywhere with me.
Literally, very much, because it's one of those things where I think that like breaking it down so people understand it, because they're like you said, it's just like, okay, so you said I have to take this, they said, like, especially because when things are not easily understood, it's easier for people to manipulate them. So I saw this whole post about like, this is how you can legally say no to the vaccine, and it was like, yeah, like they take iatrogenic medicine, and I was like, iatrogenesis has nothing, when I say nothing to do with this. And like, my mom is a cancer patient, so it's like understanding that like that means like, okay, you have things that happen as a side effect of treatment. You take chemotherapy, you probably lose your hair. Like, that is iatrogenesis. It has nothing to do with COVID vaccines. People were like, yeah, it has this iatrogenic effect, and I was like, you know what that is. So like, that's such a great analogy to really make people understand, like, this is my, step 1 vaccine. This is my step 2 vaccine. And like, this is why I'm taking it. And this is why it's important for me to follow the instructions as I've been given them. But were you going to say something, Toulia?
Yeah, I was just going to say, Abby, like what you're saying about that misinformation is why it's so important that public health professionals really partner with communities. And you have to use the same mechanisms that people are using to distribute misinformation to counter with the truth. Because if people are getting their information from Twitter, from TikTok, we need experts to be on Twitter and on TikTok circulating that information as well. Because if not, that misinformation just proliferates in the wildest ways possible. Because I saw those posts and we were all sitting there like, does this
right?
But people don't know. People see some big words and they think that, someone's
done the research.
Something that makes sense. Exactly. Done some research. And that's not the case at all. So it's really important that we counter that misinformation in that way.
And I had to, because I remember like I was really upset at that post because I saw like 3 or 4 people like I follow repost it, and I was like, oh no, we got to stop this, because that's when I like really, because like misinformation is out there, but it's just like the 5G thing. No one I knew actually believed in the whole 5G thing, so I was like, all right, that's not something I'm worried about. But when it's like, and I think this is somewhat of it is a privileged point of view in the sense of like, as someone with 2 degrees who like has a social circle with multiple people who are multiple degreed, when I see certain stuff that starts to permeate high levels of educational access, I'm like, that is a different level of misinformation. Because we can have misinformation and say like, there's lack of quality access to education, and like these are basic things that people are not being taught, and like that's something that is a problem from a societal point of view. But then when it's like, these are people who think that they know things, or they do know things, I'm not trying to like shade them or whatever, but they do know things, but it's like, that's taking away from the fact that these are misinformation things that you're spreading, and you might be a beacon or someone in your own personal community where people look at like the resources you share as like really credible information because you're someone who has these letters behind your name. So it's like, let's nip this in the bud now. And I think that what you were saying about partnering with communities is like what's so important, because kind of like when we were, prepping for this call, like Vanessa, you were kind of mentioning like people needing to be there for like their grandparents or people who might not have access to register for, or like not know how to like get online and register for their vaccination appointment and stuff like that. So what would be your recommendations to people to like who are knowledgeable in order to partner with communities, or just like have conversations, and just like ways to get them to get this information out there as much as possible, especially within communities of color?
I think it's definitely kind of tailoring the resources to what the communities have. I feel like, especially just making like the main form of registering for vaccines, or the most accessible way being through like an internet service, it eliminates populations. Because even having 2 people in a household trying to register for vaccination for my grandmother, we still were pushed out 3 months when her phase began. They began distributing in her phase in January. And so I think that like when you call throughout, like to book the vaccine, you were on hold for 30 minutes and then typically you just hang up. And so I think it's about tailoring the resources to make sure that we have multiple ways to reach communities, because having one way, one size does not fit all. And I think that's where we kind of mess up, is where we create that one way to get all the information out. We're like, this will reach everyone. But if someone's not on social media, not on Facebook, seeing the post about North Carolina or different states, like kind of moving through their phases, if they're not utilizing these resources, then like, how are you going to reach them? So we have to make sure that we kind of get multiple streams out there to really reach the communities and reach people that don't have that first main way of communicating, which is typically the internet.
Right.
And to your point, Vanessa, I think that a lot of people might have been shocked to learn that West Virginia is doing the best in terms of, or at one point doing the best in terms of their vaccination efforts. And the reason why that is the case, especially in Appalachia, it's a whole different culture and it's truly a communal feel. They were getting like the mom and pop pharmacies to have the vaccines. People were going door to door to vaccinate, to register people to vaccinate. And so, yeah, that's attacking a really wicked problem, a really large issue from a culturally relevant standpoint and truly knowing your community. And that's important because a lot of people still don't have internet access, believe it or not. Or even like if someone has to go to a job, they can't be on hold for hours on end trying to get a vaccination. They're going to probably choose going to work because that's going to have the immediate outcome and result. They need to pay their bills. They need to go to work to make money. So it's a lot. It's a lot.
Yeah. And I think that's something that I keep saying to myself, like, obviously our community is large and widespread and you can't just be like, okay, like this is, I know, monolithic and blanket for all Black people. But I've been really looking for those because I've seen some local campaigns and those, I don't know the efficacy of those in terms of data and how that's converted over, but like kind of the larger, more like national attempts. Like, I don't know if y'all saw this ad on BET where like they had like Tyler Perry host this conversation of like, are we taking it or not? And I was like, I mean, if you probably still watch BET, then maybe you are a fan of Tyler. I don't know. I'm like, and no judgment, like, you know, whatever. But I'm just like, is he the best spokesperson to have to adequately reach the masses of our community to say, now go take this vaccine if you are currently hesitant? Like, who are spokespeople, who are figures that actually activate people if you're going to do a national activation? And then who are people who are local community leaders if you're going to kind of do that like smaller level or regional kind of activation? Because I think exactly what you said, Vanessa, you have to tailor it to where people are. And obviously all Black people are not in the same space, but like if you're going to try and address all of us, what's effective for the Black community as a whole? And is it Tyler Perry? I don't think so, but okay.
Well, Abby, I think that he has his people, you know,
right.
Like
no, for sure.
There's a demographic that will respond to that. But again, it just goes back to, like Vanessa was saying, having those multiple streams. Why do you think Bernie Sanders is going to hop on live with Cardi B to discuss the election, right? It's because you have to meet the people where they are. So, I mean, maybe Tyler Perry wouldn't do it for us, but for someone he would work. And so I don't mind the effort, but I think that it just needs to be paired with all of those other instances as well. So.
Right.
And I'm like, just saying,
no, you're fine. Go ahead.
Rihanna, if you listen to this, if you tell us you're going to drop some new music, I promise all of us will stay in the house or wear a mask or get vaccinated. So there's that for us. For Beyonce, come on. Like,
no, for real. Like, because it's like, I think on the same token, I've in this year, you know, feel free to like kind of give your feedback on this of like, I've also looked at celebrities because all celebrities are influencers, whether they want to be or not, in terms of like the information they provide, even if they're not getting the vaccine yet or whatever. Like if they're like, hey, these are reputable sources, because I've seen celebrities say I'm not getting it. And this is what happened when this one person got it. Like they've highlighted the negativity, but I haven't seen people, you know, really become, and not that they have to become now like a public health board, but I'm like, if you want to talk about influence in a positive manner, like that's a way to positively influence people. And I think I've kind of been, I'm not surprised. It's like disappointed, but not surprised by like the way that I haven't seen people kind of turn out for that, you know, education.
No, I agree with you 100%. You know, city girls, love them, but they're in the club, they're performing, they're it's a mess because we're in a global pandemic. So I agree with you 100%. And I think that because we're talking about countering misinformation around people who, potentially may have access and are deciding not to. And then there's also this whole group of people who just don't have the access. And so I think that it's just, there's so many issues involved in like vaccine distribution and staying safe in regards to this virus that it feels like we're constantly fighting battles on every front. But again, that is public health, and that's just kind of what we have to do.
Yeah. So I feel like I've, vaccinated and COVID y'all out. But just kind of reaching back to this broader theme of public health, kind of what would be your recommendations or advice to someone who might hear this or be in a class or something and they're like, I'm really thinking about studying public health. Like, what would be your recommendations about like maybe books to read or things to watch, learning more in the field, people to follow, or what advice would you have to give them?
I would say go for it. I was really apprehensive on like breaking into the public health field because my background was based on rehabilitation services and then like concentrating in addictions. So I had no public health knowledge up until I think my senior year of undergrad. And I took one intro to public health course and I applied for an MPH program. So to say like I had no idea, everything I learned was online. And I definitely see there's more YouTube videos about public health now, more than ever, of course. My friend actually has a channel that I can send the link to that she talks about like entering an MPH program, just public health. But I would say go for it. If your university has an intro class, I would definitely say take it because that gets you the basic knowledge that you want and also kind of might pique your interest in certain specialties in public health that they talk about because we need more public health professionals. And even if it's just like something that you're concentrating in and not majoring in as a whole, we need more people, especially people of color, to enter the public health field so that you can advocate and can be that spokesperson and somebody will look at and listen to and feel comfortable with because of that representation.
That's awesome.
And so for me, I would say that I personally believe that all, or at least most issues are public health issues because public health is really about not just clinical like lack of illness, but also just overall well-being and quality of life. And so if there's something that you're passionate about, there's going to be literature and resources out there that talks about the way, whatever that topic is, whether it's the environment, whether it's mass incarceration, et cetera, how those impact people's quality of life and their well-being. And making that connection, I think, is so important because that might be the thing that, drives you towards public health. So I would follow your passions, but understand that if there's a problem in this world, it can likely be tied back to public health, which means that working with other public health practitioners and working with communities, we can definitely find a solution for it.
So for me, there's a couple things I would say. One, don't let anyone talk you out of pursuing public health, especially those who might not be as versed or understanding about the field of public health. I've had people be like, so you do like welfare stuff? And I'm like, well, that could be a facet, but no, not exactly. And they're like, oh, so health insurance? I'm like, no. So be true to your interests. And even sometimes that pressure can come from parents, which is warranted. They want what's best for us. But also understanding that when you enter public health, right now, it definitely can be social justice work and social advocacy work, in which means that it's needed. And public health is everywhere. It honestly is in your housing, it's in your neighborhoods, in your built environment. So if you have aspirations of pursuing, civil engineering or architectural and design, you can bring a public health perspective into nearly every space that you enter. And if you're currently a public health student, I would challenge you to take a class that you might not consider public health at its core. And I just did that last semester with a urban planning class. And I was the first public health student that my professor had. And I opened their eyes to environmental justice and just different things like that. So it's truly an integrative field. And if it's something that you're interested in, I say go for it and stay true to yourself in the process.
And I'll say one last thing specifically for Black women entering the field of public health. It's so rewarding, but it can definitely be difficult because you sit in these classes, you sit in these lectures, and you have people tell you over and over again that, your family, your friends are at high risk for this, are vulnerable to this. And that can really wear on you. So it's definitely difficult, but I think keeping in mind that what you're doing and what you're learning will hopefully help make a change in that specific area. It just keeps me going and keeps me motivated.
Girl, and to your point, I don't know about y'all, but August, actually, because Vanessa and I transferred into Virginia Tech. So anyway, I was at UNC Charlotte over the summer, and that's when everyone had a racial reckoning, like, oh my gosh, racism exists. Wow. So every other week, we're trying to have coming to Jesus conversations about race relations. You enter the fall semester, all we're talking about is police brutality and race relations and the impact on public health. And here I am at my Zoom University PWI. I'm the only Black woman in the room. I'm getting off of these calls tired, like emotionally drained. Every single assignment's like, check your privilege. And I wrote like, this assignment about privilege is actually biased, by the way. And my teacher like apologized to me. And so we're talking about heavy topics that for me as a Black woman, like it's my life too. And so there's no room for me to like check my identity at the door. It follows me into the classroom. And it's in academia, but I'm very much so having an emotional response to some of these topics and wicked problems that I'm just supposed to sit behind my computer screen for 3 hours and kind of just like take and, be a voice in the conversation. Or like, wow, I really loved your perspective on that. It's not something I thought about. And I'm just like, Google is free. So it's been a lot over the last year.
Yeah, I don't miss out from undergrad too. Like, and just like, I had a little bit less in grad school just because it was a very interesting mock-up of students. But yeah, consistently being like that Black voice in the room, and then like the Black voice that like speaks up and is like very engaged. So then people are like, oh, like you're going to be our Black guide through this conversation. And it's like, I'm actually not, but like, I'll give my opinion when I feel like it's necessary, but I'm not here to be like, like your emotional like support through your anti-racism and like anti-white supremacy work. That is your work. I live that. Thanks. And I think just reminding Black women too that like you're not required to be the backbone of these classes. You're not required to be like the pack mule of people's emotional baggage, even though people want to make you their friend and like the magical Negro of your relationships. In school and work, and especially when you do this kind of work, because even when I think we look at this vaccine situation, I see so many Black women in public health and education and community leadership taking on the responsibility of getting this message out and developing the vaccine itself at Moderna, so, just give ourselves some grace and continue to practice appropriate self-care for our individual situations. But I want to thank you all for coming today. It has been an amazing conversation. So good. And I want to make sure people can get in contact with you if you're okay with that. Just let people know, like if it's social handle, if it's email, whatever you feel comfortable, like letting people know if they have questions or if they want to reach out to you directly about your programs or whatever. Feel free to shoot them that just so that they can contact y'all directly.
Yeah, so I am on Instagram at Naija, NAIJA_made me. And also recently at Black Girl in Boston. So follow me on either of those accounts.
I'm on Instagram as well. My handle is at itsnessa, so ITSNESSA_Sary, so SARY. You can also feel free to email me if you have any questions about like what we discussed today or just about the MPH program at UNC Charlotte. And my email is vmallory, so VMALLORY @uncc.edu.
And I'm on Instagram. My Instagram name is Breana_Gabrielle. I will spell it. It's BREANA_GABRIELLE. And just DM me on Instagram. I check my message requests. I promise I won't block you if you DM me.
And I'll be sure to tag you guys in the post, like when this goes live and everything, like they'll be able to hit right to your IG. Also, before we go, I'm just going to put, this out there. And that is that in addition to the pages that you guys can follow here, you can also follow Black Women Heal, which is an extension of my agency strategies platform. It's focused on sociopolitical advocacy, affirmation, and holistic wellness of Black women. So that's at Black Women Heal _. And we just do all things that are positive Black women space and vibes. So, come over. Give us a scroll, give us a follow. And I'll be happy to have you as part of our community as we get ready to plan our conference coming up. So thank you guys once again for being here. I really appreciate it. And I think this is going to be extremely informative and helpful for all people. So thank you so much.
Thank you.
And having this conversation is definitely important.